Hello everyone, welcome back to OptoInsight. If you watched my last video on Clésion, you know that we discussed those pesky bumps on the eyelid. Well, today we are talking about another common eyelid bump, which is stye. If you have ever had one of these, you know it can be painful, red and very frustrating. So in this video, I'm going to explain what a stye is, what causes it, how to treat it, how to prevent it from coming back. Let's get into it. Alright, let's start with the basics. A stye is a small painful bump that appears at the edge of our eyelid, typically caused by a bacterial infection. Unlike a lésion, which is a blocked oil gland, a stye is caused when the oil glands at the base of your eyelashes become infected with bacteria, usually Staphylococcus. Styes are often red, swollen, and tender and can make your eye feel like it has something stuck in it. They can also cause a lot of discomfort, especially when you blink. So what exactly causes stye to form? Well, there are a few factors that contribute to this condition. The most common cause is a bacterial infection. Normally, the oil glands around your eyelashes keep your eyelid moist and free of bacteria. But if those glands become clogged, bacteria can get in and cause an infection, resulting in a stye. Also, if you touch your eyes with dirty hands or don't remove your makeup at night, bacteria can build up, increasing your chances of developing a stye. Like lésions, styes can also be triggered by blocked oil glands, or unlike lésions, styes are usually infected and involve bacteria, making them more painful and swollen. If you have a condition like blepharitis, you have more prone to developing styes because of the irritation and bacteria buildup around your eyelid margin. Now, how do you know if you have a stye? Well, the symptoms are pretty clear and they typically appear quickly. Here's what to watch out for. The most obvious symptom of stye is pain, especially when you touch the bump. It feels sore and blinking might irritate it even more. Your eyelid will likely become red and swollen around the stye. It can even cause swelling of the entire lid. It often has a small yellowish or pus filled tip that can be seen on the bump. It's the only pus that indicates the infection. Because of infection, your eye might start watering more than usual. You might also notice some crustiness along your eyelashes. So, how do you treat a stye? Thankfully, most of the time, styes go away on their own with a little at home care. Here are some of the best ways to treat one. First thing first, a warm compress can do wonders. Apply a warm, moist cloth to the affected eyelid for 10 to 15 minutes, 2 to 3 times a day. The heat helps to loosen the pus and relieve the swelling. It might be tempting to pop the stye, but don't do it at all. Squeezing or poking at the stye can cause the infection to spread or worsen. You can also try over the counter antibiotic ointments or drops, which can help to clear up the infection. Just make sure to follow the instructions carefully. Keeping your eyelids clean is a key. You can gently cleanse your eyelid with a baby shampoo and warm water solution to remove any debris and bacteria. So, usually, most of the styes resolve on their own, but there are times when you should definitely see a doctor, eye health physician, optometrist, ophthalmologist. If the stye doesn't improve after a few days of home treatment, or if it is getting bigger or affecting your vision, also if you develop multiple styes at once, or if the infection is spreading, and if there is significant pain or discomfort. In these cases, your doctor may prescribe oral antibiotics or even drain the stye to help it heal faster. And also, as you all know, prevention is a key. So, now let's talk about prevention. The good news is that styes are often preventable. Here are a few tips to keep in mind. Wash your hands regularly and avoid touching your eyes. Remove makeup before going to bed. It's very important for your skin also and eyes also. And clean your makeup brushes regularly. Practice good eyelid hygiene, especially if you have conditions like blepharitis. Avoid shading towels or eye makeup as bacteria can easily spread through it. So that's a wrap on stye. While they are uncomfortable, they are generally easy to treat at home, but don't hesitate to see a doctor if things are not improving. And if you are dealing with a lesion, be sure to check out my previous video where I dive into how lesions differ from stye and how to treat them. If you found this video helpful, make sure to like, subscribe and hit that notification bell so you never miss an eye health tip from optoInsight. And as always, feel free to drop your questions or comments below. I am here to help. Take care. Goodbye.